folks that treated themselves well at the bar last night, I can see. So anyway, thank you again, Tom and Vivian, and also for the congenital symposium organizers, Matt and Tom, for a job well done. I'm going to talk today about the Lee VSD Occluder, a device made by PFM. These are my disclosures. Of course, we'll start off with a little bit of a review of the pathophysiology of paramembranous VSD. I want to focus a little bit on some data that's emerging about unoperated patients, especially into adulthood. I'll discuss briefly the evolution of the surgical management of VSD and then sort of the approach of device treatment that's evolved over time. And then, of course, spotlight the PFM Lee VSD Occluder design, some of its characteristics and some of the clinical performance data that's now available. And in the final few minutes, talk a little bit about the current regulatory hurdles in the U.S. that are delaying our initiation of a clinical trial here in the U.S. So, of course, everybody knows VSDs are the most common congenital defect occurring as an isolated lesion if you exclude bicuspid aortic valve. If you look at echo series in newborns, actually there's a much higher incidence of VSDs. Many of these are small muscular defects that close spontaneously in the first months of life, so they typically don't count. These defects, the paramembranous defect is adjacent to the membranous septum and lies entirely, at least largely, underneath the septal leaflet of the tricuspid valve. And of course, the primary determinant of need for intervention is based primarily on the size of the defect. And depending on what center you're at and what your philosophic beliefs, it turns out that most VSDs that are at 4 or larger millimeters in diameter are often referred for surgical repair. Untreated VSDs in adult patients have a little different outcome. There's a picture of 2 adults there, although you might argue with the second person there but he's not here to defend himself, so we'll leave that for your discretion. There's a recent series that was published in Belgium where they reviewed their database and queried for adult patients over the age of 16 with unoperated VSDs. And they found 220 patients in their database with follow-up that ranged up to 28 years. During that period of time, there was 2 patients that died of cardiac-related death. There were 8 individuals that developed endocarditis. 1 patient needed a pacemaker, another an ICD. 7% of the total were referred for a closing procedure. About half of those were surgical and about half were device closures. There was a spontaneous closure rate in 4%, however. But if you looked at the remaining individuals, a large number had QRS morphology changes.